Good evening, everyone. I'd like to welcome you to this public webinar where we have the opportunity to talk about COVID-19 vaccines, which is a very important subject for all of our community. I'm very pleased this evening to be joined by Dr. Will Memaris, who's the Director of Public Health at Haringey Council, and also Dr. Sheena Patel, who is from the Bounds Green Group practice, which is one of the GP practices that deliver COVID vaccinations to residents. I have to say one of Dr. Patel's team stuck a needle in my arm only last week. The objective of this evening's meeting is to provide an update on the vaccination program, on its rollout in Haringey, and also to give residents the opportunity to ask questions. We've had some pre-submitted questions on vaccines, and we're seeking to answer the queries that our residents have. I want to say a few words just by way of introduction, and then I think it's the opportunity there will be there to listen to our speakers. If you are watching this live on Facebook as well, which I hope that you are, you can also post questions into the message board on Facebook, and I'll pick the questions up later on if we have the opportunity after we've responded to the pre-submitted questions. Then we'll ask our panel to see whether they can answer those as well. Yesterday, we heard from the government about the so-called roadmap out of lockdown. I think it's been a very long time coming, but I'm sure that you, like me, are looking forward to a time when we can do more of the things that we enjoy doing, and that we can spend more time with friends and families. We can go out and enjoy our high streets, restaurants, other social places, maybe even go on holiday. But as we know, the pandemic isn't over just yet, and there's still a lot more that we need to do. And even once people have been vaccinated, it's important that they still pay key attention to the public health guidelines. It's important that when as many of us as possible are vaccinated against the deadly virus, that it shows that we're getting close to the light at the end of the tunnel. However, I have to say that I'm deeply concerned about some of the early indications that not all of our communities are feeling able to take up the offer of a vaccine when it's being made. As leader of the council, I'm concerned that some parts of our community could be left behind on the journey out of the COVID pandemic. I'm clear that the objective of this meeting here today isn't to lecture people, and it's also not to patronize people. I can understand that many people have genuinely held concerns about the vaccine, and that's why we are holding this event this evening, just so that our residents have the chance to ask questions and get answers from experts like Dr. Will and Dr. Sheena. We want to ensure that everyone in Haringey has access to factual and accurate information about the virus. About the vaccine for the virus. The link to this session will be available after the event, so please, it'd be grateful if you could share it with friends and share it with families. If after you've been vaccinated, if you feel comfortable sharing your story, then please get in touch with me. We'd love to use your story to inspire other residents in order to get vaccinated as well when their turn comes, and for them to start taking a journey to protecting themselves and their own loved ones. As I said, it's almost a year since we went into the first lockdown. It's about 49 weeks since we went into the first lockdown. That's a long time ago, and it's important that we do see that we're getting close to the end of this tunnel. But part of getting out of lockdown is ensuring that transmissions and infections of the coronavirus continue to reduce. And that's going to mean that not just more people getting vaccinated, but also people paying attention to public health guidance and guidelines. We've made so many sacrifices. It's really important that we don't lose all of the things that we've done already by not taking this opportunity for the vaccinations seriously. Right, as I said, it's about asking questions of experts. So I'd like to introduce the first of our two co-speakers this evening. The first speaker is Dr. Will Memaris. Dr. Will.
Thank you very much, Leader. I'm Dr. Will Maris. I'm the Director of Public Health for Haringey. It's really great to be here today. Somewhat strange kind of talking into a screen of the Haringey residents out there that we can't sadly see. We've been doing lots and lots of engagement with faith leaders, people from different communities around the COVID vaccination, and this is another opportunity to do the same thing. So I'm going to say a few words about the current situation with COVID in Haringey and the vaccination programme. So sadly, last year there were more than 300 COVID deaths in Haringey, and the impact of this did not fall evenly, with bigger impacts felt by people from poorer communities and for people from some Black and minority ethnic communities. We're currently just past the peak of the second wave of COVID in Haringey. And thanks to our communities working together and following the stay-at-home message, COVID rates are falling. So they're now 10 times less than they were at the peak of COVID around Christmas and New Year. Rates are still high though, so there's still work to do. And it's really important that people follow the public health guidance, which is all about staying at home where possible, keeping your social distance, wearing your face coverings, washing your hands regularly. These messages will be so familiar to you by now, but they're worth saying again. So I wanted to talk now about the COVID vaccinations. I mentioned the toll that COVID has taken on our local communities. And now we have safe and effective COVID vaccines that can help protect our communities. And we started with the most vulnerable groups. So all over 70s and people with clinical vulnerabilities or high levels of clinical vulnerabilities should have been invited for their vaccination. More than 17 million people have already had a first dose of the vaccine in the country safely, and around 25,000 in Haringey. The vaccines will provide protection against COVID infection and against serious illness from COVID. From a personal perspective, I'm really pleased that my grandma, who turned 100 last year and is currently in a care home, has had her vaccine, and also my parents who live in Haringey, who are in their 70s, have had the vaccine. In terms of where you get vaccinated in Haringey, there's two main GP-run sites at Lordship Lane Medical Centre and Bounds Green Medical Centre. And we now have what's called a mass testing site in Crouch End at Hornsey Central. Anyone who is 65 or over and who hasn't had their vaccine yet can book by going online and searching for NHS Book COVID vaccinations. So if you're in those eligible groups and you haven't had your vaccination, I would really urge you to do that. It's really important that all our communities are protected. If a particular area or community is not protected, we'll have the risk of serious outbreaks later in the year. And at the moment, vaccination rates, which are about 75% overall in our over 70s, are noticeably lower in Haringey in the east of the borough, and in particular in Black ethnic groups. And that's something we're really working hard to address. I know that people will have understandable questions about the vaccine. And what we really want to do today is have the opportunity to hear from you in terms of the questions that you have and address some of those questions. I'm going to hand over now to Dr. Sheena Patel, who's a GP working on the front line in Haringey and has been involved in the vaccine delivery. So Sheena, over to you.
Hello, my name's Sheena Patel, and as Will said, I'm a GP at Bounds Green Group Practice. Back in October, we were asked who would be keen to take on COVID vaccination centres, and we put our hands up. And actually, I can't think of anything better to have done over the last 3 months. It's been busy, but actually, as Councillor mentioned earlier, this is our way of coming out of this pandemic. And unless we all come together and do this, I think we may have repercussions of this later on. I also agree with the councillor that we're not here to preach. I ran a clinic in St Anne's a few weeks ago on a Saturday, and it was great to be able to answer questions from people, to say to them that actually, even if at the last minute you have questions or concerns, the people who are giving them have those answers. And if they don't know the answers, they go and find somebody like the clinical lead, like myself, to come and answer some of those questions. what I wanted to do, I mean, and I agree with Will, it's been fascinating. We've vaccinated a huge amount in Haringey, but what worries me is there's small groups that are not, and probably some of those people are the people who are the most vulnerable. And so, as Will also said, we've been talking to different faith groups, we've been doing small outreach clinics as well, we've been doing housebound for people who can't come out to us. We're trying in lots of different ways to try and vaccinate all of our residents in Haringey. And I feel we'll get there, and I feel it has improved, but I think we're not there yet. So when your time is, when you receive a text message or a call or an email from your GP or from NHS England, please take it up. Please come and see one of us in one of our centres. There's 3 across the borough at the moment. I thought I'd discuss just a few things that people may well have concerns about. The one of them is the reluctance that people from Black and ethnic minorities may have about taking up the vaccine. And I know this stems to sort of deep mistrust in government and in medical professionals. But I'd like to reassure you, I mean, I myself have had one. I, being on the front line giving the vaccines, needed to be sure that I was safe for my people who were coming to see us. It's been tested by an external body. So the MHRA did not take this lightly. And there are lots and lots of vaccines out there that haven't passed the test. So again, that reassures me. The other thing is as Will said, we've given 13 million just in this country, and that's, you know, there's many more millions across the world. So we're learning lots, and as we go along. And for those people who thought they'd watch how things go along, maybe now's the time to come out and say, okay, I've watched, I've seen that people are fine, and now is your time to come forward and have yours. The other thing that, doing my reading just before coming on today, there's lots of things that are coming up about fertility and pregnancy, and lots of young women who are not taking up the vaccine because of this. And I wanted to find out why this had come out, and there was some very small, some very tiny piece of evidence that I could find, but it was been blown out of proportion, and actually there is nothing that I could substantiate to make sure to see that there is any evidence that there is a link to infertility. If anything, if somebody has COVID when they are pregnant, actually they may well have it could cause miscarriage, because being that it can be quite a severe viral infection. I mean, and in men, there is also the theoretical risk that they can get an infection of their testes if they get COVID. So again, it could be detrimental to people's fertility, actually, to have COVID. The other thing is about side effects. I had a lady, I was discussing with her, that she was worried that the side effect of the vaccine, her neighbour had been poorly with it. And after having a long discussion with her about long COVID, and we're learning more and more about this horrible disease that is protracted. And therefore, for me, balancing the two, I feel that having maybe a couple of days of having a sore arm or feeling a bit unwell with the vaccine is probably a trade-off to not getting any of the effects of COVID or long COVID. As mentioned, I think it's quite sensible that, it's quite, this is an opportunity to answer some of the questions. And I know we've got some questions that have been sent in through to us, and also we're going to be watching some of the questions. So if I hand back over to the councillor.
Thank you very much. I didn't introduce myself when I did introduce my co panelists. I'm Councillor Joseph Ejiofor. I'm the leader of Haringey Council. Right, let's rattle straight on with the questions that we've got already. The first one is for Dr. Will. Dr. Will, please can you tell us about the effectiveness of the vaccines? Are they effective against variants? Can you give COVID-19 to somebody else after having the vaccine?
Thanks, Lee. That's a really good question. So in terms of effectiveness of the vaccine, and I'm going to talk about the main two vaccines that are delivered in this country, so the Pfizer vaccine and the AstraZeneca vaccine. So we have now two sources of information about effectiveness. So the first is from the trials that were done, whereby some people were given a placebo vaccine, which didn't have any of the active ingredients, and some people were given the vaccine itself. And those trials, they firstly showed these vaccines were safe with very few side effects. And they also showed that the vaccines were both effective at reducing serious disease and hospitalizations, with virtually no serious disease, deaths or hospitalizations in the people who received the vaccine. In terms of the effectiveness, I think the figure for the Pfizer vaccine was somewhere above 90%, and the figure for the AstraZeneca vaccine, there were different figures depending on the regimen, between sort of 70 to 90%. And what that means is, for every 100 people who would have got COVID had they not been vaccinated, if you're 90% effective, that means only 10 of those 100 would have got COVID. And the evidence suggests that the infection in those 10 people is much less severe. The other thing that we're learning now is from the real world. So from studies in Israel and in the UK. So the UK, actually, we've made good progress on vaccination. We've got the third highest vaccination rate of any country, but Israel has the highest. So we were able to see the effect in the real world. And for the Pfizer vaccine, because that's what's been given mainly earlier in those two countries, we see that the one dose, so just a single dose of the Pfizer vaccine, prevents infection in 75% of people, and prevents symptomatic infection in 85%. And that's in the kind of younger general population, but in older people, it seems to be effective as well in the over 80s, significantly reducing hospitalizations and deaths. So we're already seeing the impact of the vaccination program on reduced hospitalizations and reduced deaths in the UK. In terms of the variants, so the main variant we have at the UK at the moment was a new variant in the UK. It was original COVID that mutated, and that's been the prevalent strain since about November last year. And that's what that data that I just quoted around kind of real world effectiveness, so it does work against that variant. There's some concern about some existing variants, so variant from South Africa and potential new variants which may emerge. So for the South African variant, we really don't have a lot of information about how well the vaccines work. So it looks like the effectiveness is reduced, but there's also evidence that serious illness and hospitalizations are still reduced in the South African variant. The other thing to remember is we have very few of these new variants in the country at the moment, and with the lockdown, and that's why it's really important that we get case rates down through the lockdown and social distancing, as well as vaccination. That will help to suppress these new variants. It is highly likely or probable that new vaccines will need to be developed as the COVID virus mutates and changes, so we can respond to those, and may become like flu. So every autumn people have a booster or an updated jab so that they can get protection over the latest strains. However, it's really important that people who are eligible take the current vaccine, because that will give a good protection against the strains that are circulating in the UK at the moment. I also mentioned the importance of lockdown. So we don't know if you've had the vaccine, whether you can transmit, or the risk of transmission of COVID. However, it is likely, because we know some people with vaccines still get COVID, there is some level of transmission. So it's really important, even if you've had the vaccine, that you keep on following the public health rules. And we've now got a roadmap out of the kind of lockdown measures, but it's really important we stick to the current guidance at the time. So just to give you an example, my parents have both had the vaccine, but I would not encourage them to give hugs to people outside their households yet. Definitely not until they've had the second jab, and until rates are much lower in the community. So I hope that's answered that question. It's not the shortest answer I've ever given. I'll hand back to you, Leader.
Thank you very much, Dr. Will. Next question for Dr. Sheena. Can you tell us about the ingredients in the vaccine and how they might affect existing health conditions? This is particularly with regards to medication, allergies, cancer treatment, etc. What is the worst reaction that you've heard of, and was it treatable?
Okay, so I mean, the ingredients in the vaccines are quite similar to other vaccines, and the technology is slightly different, but the actual ingredients are the same. So it is safe. There are very few people that can't have the vaccines. First of all, children. But there are studies going on at the moment to see if some of the vaccines will be safe for children. At the moment, Pfizer can be used for 16-year-olds and upwards, and AstraZeneca for 18-year-olds and upwards. So the biggest question we ask when we're giving the vaccination is to say to people, have they had any issues or problems when they've had vaccines previously? There is now that we now know that there is an ingredient called PEG, which is in lots of vaccines, not in all, that seems to be the thing that causes allergic reactions to people. Now, when the vaccines were first given, there were 2 people who had a reaction to the vaccines, and luckily it was in hospital. It wasn't a severe reaction, and these people carried EpiPens, and so therefore we needed. So we are now have an observation period for watching people. However, we've given 13 million vaccinations in the UK, and I've not heard of any major reactions that have occurred since this time. So initially, we were very cautious as to who we were giving the vaccinations to. But now, as long as you are not allergic to vaccines, then we would offer it to anybody. So people who carry we had a question from one of the residents who asked that if they carried an EpiPen, should they still be vaccinated? Definitely, yes. As long as they not had a reaction to vaccines, absolutely no problem. It's absolutely fine, and it's very important that people who are clinically vulnerable do take up the vaccine, because it is actually going to be important for them to have it rather than not. The worst reaction, I haven't seen any reactions, to be honest. We've had a few people who feel a bit faint, but that happens in flu season when we give flu vaccines. And as I said, the main concern was this allergic reactions that had occurred in 2 cases, but actually have not been substantiated since. What we do is anybody who has any reactions, we feed it back via something called a yellow card. That goes back to the company who are producing the vaccines, who then can distribute that out afterwards. And this is how safety data is collected. So be assured that it's all being collected. All of the information of any adverse events is being collected.
Okay, thank you very much for that, Dr. Sheena. I do think that when you're talking about 13 million, I was just checking the latest data. I think we've got just up to 18 million now.
Wow, I missed a day there.
a couple, 2 days. So we're up to 18 million now. So I know that when you were saying that people might have a little bit concerned about not wanting to be first, now they're in danger of not being in the first 20 million. And there's only 70 million people in the country. So really and truly, it's about time to get on with it. Dr. Will, why do we define who is a frontline? How do we decide who is a frontline worker? In Haringey, why do we define it in a way, especially given that other boroughs are approaching the definition differently? So is it a case that boroughs can choose who can be vaccinated and who can't?
Thanks, Leader. Another really good question. So it's not at the discretion of individual areas around who can be vaccinated and who's in the priority groups. There is something around interpretation of some of the criteria, which I'll come to later. So the priority is based on who is most at risk if they get COVID of dying or having serious illness. So the main risk factors are age and whether you've got an underlying health condition. So the first priority was to get people in care homes and the staff who looked after them vaccinated, and then people from age 70 upwards, as well as clinically extremely vulnerable people. And that was the kind of target, to offer everyone in those groups the vaccine by mid-February. So once we've moved through those priority groups, which also includes health and care workers, which I'll come to later, then the next groups, it's by age, so 65 plus, 60 plus, and then going down to 50. But with the older people in that age group, it's also people who are clinically vulnerable, not clinically extremely vulnerable, clinically vulnerable. So that includes the kind of people who would get invited for a flu jab every year. It also includes carers, of people, family carers of people who are in those clinically vulnerable groups as well, which I think is really important. Now, in terms of health and social care workers, we have been, as a local authority, we have responsibility for identifying who it qualifies as a frontline social care worker. And the definition of that is someone who provides frontline, one-to-one, face-to-face support with people who are clinically vulnerable themselves. And the rationale for picking that group is not just to protect the worker themselves, it's primarily to prevent spread and protect the people that they're working with. So that's why it's really difficult for, understanding case transport workers, quite a high risk of COVID complications. Teachers, not as such a high risk, but obviously quite a lot of exposure. But for those groups, it's not done by occupation, it's done by their own clinical risk. So people who in those professions who are clinically vulnerable or in the age categories will get vaccinated. I'm sure these categories are going to get reviewed as we go forward. The ambition is to offer vaccination to all adults by the end of the summer. So we'll all get our time in turn. But at the moment, prioritization is based on those with the highest clinical need. So while we've got people, for example, with learning disabilities out in the borough who haven't been vaccinated, I don't think there's a strong case for vaccinating teachers as a kind of blanket approach at present, but recognise that the needs and the sacrifices people have been making who work on in those frontline roles. So I think that's the end of my answer to that one.
Okay, thank you very much for that, Dr. Will. Dr. Sheena, if Black and minority ethnic people are more vulnerable, why are they not being prioritised for vaccination?
So one of the things that I mentioned earlier is that we're learning as we go along, we're learning more and more. And so when we embarked on this, the data was taken from people who would get COVID and would potentially die from COVID. Now, as we've looked at different groups, we've seen that more BAME people are affected, and also that they may not do so well in long COVID as well. So actually, something new has just been released, something called a Q-COVID scoring, and this has taken lots more things into consideration. So it's taken in deprivation, it's taken in where people live, it's taken in their ethnic groups as well. So with all of this, there will be more people who have come to the surface that we will now be calling over this last week. So the Q-COVID has been able to pull data from lots of different systems. And so hopefully now these people will be prioritized as well. But actually some of those people will probably have been picked up in the clinically vulnerable groups as well. So it is not just looking at ethnic minorities in one group, but it's incorporating lots and lots of different factors to try and prioritize people. I hope that answered that.
Lovely, thank you very much, Dr. Sheena. Dr. Will, does it matter which vaccine I get, whether it's the Oxford or the Pfizer or the Moderna? Will I get the same? Do I need to get the same second dose as the first? And does it matter which one I'm prescribed?
So you will get either the Pfizer or the AstraZeneca vaccine. I don't think we're using the Moderna vaccine, and that will depend on availability at the time. Both are effective against the COVID strains circulating. There's no preference of one over the other. I wouldn't encourage people to get one over the other with friends or family. My understanding is that depending on the first vaccine you get, so if you get Pfizer first, you will be given the Pfizer vaccine at your 12-week follow-up if that is available. So that is the preference, is to have the two jabs that are the same.
Sorry, even I've got to ask a follow-up to that one. You said if that is available, what if it's not available? Is there a problem with having vaccine A to start off with and then vaccine B to follow up with?
I think that's being looked into at the moment, but only if there's a real problem with availability and supply will that come into play. So that people will get the same or should get the same unless there's an issue that arises, and then there'll be some guidance developed based on evidence from kind of mixing vaccines, etc.
Okay, thank you for that, Dr. Will. Dr. Sheena, when did the length of time change between the first and second dose from 3 weeks to 12 weeks? And what changed that guidance?
So it happened at the beginning of the year, just as we were starting to give some of our second doses. And it was a public health issue. It was a public health decision that the government took. So they saw that rates were climbing, rates of COVID were climbing in the country. And this decision had to be made that should we vaccinate everybody with one vaccine? And as Will mentioned, the amount of coverage that you get just from having the one vaccine is quite significant. So actually, I think it was the right decision at the time, that by enabling more people to have at least that first, I think we've been able to get where we're at. But also doing the other thing of, of social distancing and wearing masks and washing our hands, and all of this has helped as well. So yeah, I do think it must have been quite a hard decision for people to take, to say that, okay, it's going to be pushed forward. The reason why was it 12 weeks, and that's because some of the data, that's what the data had looked at. It was looked at between 3 and 12 weeks, and that's why 12 weeks was chosen at the time as well. So it's not just that somebody plucked a figure out of the air and decided that that's what needed to be done. I think it's been the right decision. I think we've sort of moved further forward because of it.
Okay, thank you very much for that. Dr. Will, where can I get my vaccine? What about, and as a follow-up to that, supplementary to that, what about elderly people who can't get to the sites because they're bedbound?
Right, I'm going to ask Sheena to come in a bit, but just the primary places where you can get your vaccination. So the majority of people in Haringey have had their vaccination at the sites run by our local GP practices in Bounds Green and Lordship Lane, and people will have been received invites for those sites, and they run very efficiently. So Bounds Green is up in the north of the borough, and then Lordship Lane in the east. And then a few weeks ago, a mass testing site opened in Hornsey Central. So that's a big facility in Crouch End, and slots there can be booked for people who have been sent letters. So everyone who's eligible should now have been sent a letter inviting them for vaccination, and people can book through that mechanism. If you're in the eligible groups, you can also, you're over 65, for example, and you haven't had your jab, you can also go onto the NHS COVID vaccination booking service and book your vaccination at one of the mass sites. And there are some other options. There's a pharmacy, for example, in West Green Road, which is offering vaccination. So there's a number of different options. In terms of housebound patients, yes, we are going out, the GP Federation and are going out to vaccinate housebound people. I think I'll hand over to Sheena, who might be able to give us an update on how that works and some of the feedback from how that's been working so far.
So first of all, when we had Pfizer just by itself, it proved quite difficult. So we could get out to the care homes, and I'm doing actually some seconds of the very first care home that we did tomorrow. So because the Pfizer cannot move. Now that we've got AstraZeneca, we can go from house to house and do our housebounds. We have done, and I might be a little bit off because it's happening daily, we've done probably almost half of the housebounds that have been sent to the Federation. The GP Federation is organising these. It needs a team to go out, so we've got some great paramedics and nurses who are doing this work. It's the AstraZeneca that comes to the house because it can be moved from location to location if people don't know that the Pfizer is quite delicate and cannot be moved. So it's happening. And if you are housebound, you need to just let your GP know. What we did initially is look at people's GP records. Not we, but each GP practice looked to their own records to submit the housebound lists. But if there are any people who feel that they've been left off of that list, they just need to contact their GP, who will then forward that to the Federation.
Okay, thank you, Dr. Will. Do you expect it to be mandatory for people to have had a vaccine before they're able to travel?
So this is an area which is being looked at the moment. So there's a couple of issues here. So we're talking about things like vaccine passports, so evidence that you've either had COVID infection or you've had the vaccine, to require you to do certain activities like go to a football match or a concert or go on an aeroplane. So I think that these are things that have been looked at. They'll be looked at by individual countries and they'll be looked at internationally. But at the moment, there's no plans. There's nothing in place at the moment. But you can imagine, particularly with kind of new variants, that there is likely to be some, suppose some just precautions around this, like we see with some other infections like yellow fever vaccination, which you need for other countries. But we'll see. This is a work in progress.
Okay, thank you. Can I ask if you could explain a little bit more about the 9 categories of people who are being considered for vaccination, and if people don't sit within those 9 categories, are they just should they just wait?
So I can start. Sheena may want to chip in. So I did talk a bit about this earlier. So the first 4 priorities, so it's going, so top number 1 is the top, and then down to 9 were care home residents and staff, health and care workers, people over age 70, and people in the clinically extremely vulnerable group. And they should have all received their first invite. And then the next group is going down by age, over 65 to 70, 60 to 65, then 50s. And within that also people who are clinically vulnerable themselves, and carers for people who are clinically vulnerable. And within the clinically vulnerable, there's a really big list of conditions, from people with learning disabilities to people with diabetes. There will be people who may feel that they've missed out because of their clinical condition maybe hasn't been recorded by their GP. So I would urge people who think they are eligible for the vaccine because of they should be in one of these clinically vulnerable groups to have a conversation with their GP. There will be other people who feel strongly that they should get vaccinated because of other concerns. Maybe they've had family with COVID. But at the moment, if you're not in those priority groups and you haven't been asked yet, we're not fully even down to those 9 priority groups. The advice is to wait, and we should get all adults, as I said, by the end of the summer.
Okay, thank you very much for that. Just a couple of other questions that are now coming through the Facebook page. I'm currently ill with COVID. Assuming I'm currently ill with COVID, should I be getting the vaccine?
No.
Sheena, do you want to pick that one up?
Yes, yeah. No, unfortunately not. So one of the questions we ask when you come for your vaccine is that, have you had a positive COVID test in the last 28 days? And we would recommend that you wait 28 days before you have it.
Sorry, is that 28 days from the test or 28 days from being clear from COVID?
No, from the test.
So 28 days from testing positive.
Yep.
Before you go and have the vaccine, rather than 28 days from testing negative.
You wouldn't be tested negative.
No, when you're clear, you get it all clear, wouldn't you?
Yeah. No. It's from your positive test. So
okay.
Yeah.
Okay, thank you. Is there evidence that young people are less likely to get COVID-19 than other age groups?
So I can pick that one up. So if we're talking about the very young, we're talking about young children, the rates of recorded infection seem to be lower than other age groups. But actually what we've seen in Haringey is the highest rates of infection have been in kind of young working age adults. So the risk of getting infection is really dependent on your social contacts and your level of exposure. And young people at university, people going out to work have tended to have the highest risk of exposure and the highest rates of infection. However, the rates of serious illness are far, far lower, particularly as you go sort of below 50 with people without underlying health conditions. It's really unusual for people to get unwell and have to be admitted to hospital. But because so many people have been infected with COVID, even some young people have been in hospital and been in intensive care and sadly died just because the sheer numbers of people who are infected. But yeah, so that infection is actually more likely in working age people than what we've seen in Haringey. but serious illness is much less likely in working age people and even less likely in children.
Okay, someone told me that COVID-19 isn't really harmful to young working age people. Is that true?
So I think I kind of covered that in the previous question. So it's certainly a less severe infection generally in young working age people. However, there's a couple of issues here. So one I mentioned is just the sheer number of people getting the infection means that you know, maybe unlucky or have some predisposition and become seriously unwell or die. So we do see deaths in that group. And then the other issue is people, you know, even people who kind of recover well, it can be a really unpleasant illness for a short time and lay you low, or you can develop longer complications, what we call long COVID. And we're seeing lots of that even in kind of younger people who have really struggled with their kind of energy levels and other physical symptoms long after they've been infected with COVID. So it still is a concern, you know, it's still as a young adult, you don't want to catch COVID.
Okay.
Can I mention one thing before you move on? The biggest thing that we worry about is people who are quite fit in themselves, but passing it on to somebody who is not fit. So they're the people that then could have the repercussions of somebody's illness. So they may not be unwell themselves, though.
Is that about asymptomatic transmission?
Absolutely.
I've got a question on asymptomatic transmission, which I think you've just answered. Is asymptomatic transmission just a fallacy?
So it certainly isn't a fallacy, and there's two dimensions to this. So you can certainly then there's really good evidence that you can transmit infection at the early stage of an illness where you have no symptoms or mild illness, and there's also evidence that you can have very, very mild symptoms or not report any symptoms at all, and you can still test positive and still potentially spread the infection. And that's why it's so difficult to manage COVID, because in many people they are spreading the infection without even realizing it, and it's spread very easily. And that's why we're so limited in what we can do in terms of social contact, because if you have lots of people meeting in a nightclub, there's potential for lots of spread of COVID.
Okay, thank you very much for that. I've got another question. I've had my flu vaccine. Do I still need a COVID-19 vaccine as well?
Yes. So there's different vaccines for different conditions, and if you're eligible for the flu vaccine, it's probably really important that you get the COVID vaccine as well. And they're similar in terms of the people who are at risk of severe flu infection, and there's people who are at risk of severe COVID infection.
Okay, and Dr. Sheena, is there a time limit between the two when I should have them, or can I have them both at the same time?
Sorry, no, you can't have them at the same time, which is a bit annoying, whereas sometimes we do vaccines together. I think it's more just that there's not enough evidence as to having them together. So we recommend a week apart. Luckily, we've finished most of our flus now, but it was really important in the early stages that we had to be careful that they weren't together. So a week apart from any vaccine is recommended, not just a flu vaccine.
Okay. In terms of the vaccination itself, I'm assuming that it won't last forever. So are we looking at getting to a situation where there's a yearly vaccination process?
So I mentioned that earlier, so it does seem likely. So we don't have a lot of evidence on the duration of protection afforded by the vaccinations, just because they haven't been around that long. But from what we've seen, we're talking about at least months of protection, of good level of protection, particularly with the second dose. I think more of a concern is the vaccine, the virus changing and mutating and becoming less responsive to the vaccines. And that's a combination of both boosting your general immunity through an annual jab and changing the jab so it contains different response to the variants that are circulating at the moment. Make it, we don't know, but it seems likely that may happen. So by the time we finish vaccinating everyone once, we'll have to start all over again in the autumn with the boosters. So for Dr. Patel and her teams, they're going to be very busy, I think, and continue with their great work. My concern actually is more about the people who we're missing at the moment. So if we're talking about, nearly 50% of our Black population over 70 haven't had the vaccine, that's really concerning come the winter time and come COVID circulating again, the number of people who are still vulnerable to the really devastating effects of COVID. So that's really sort of number one on my list as Director of Public Health at the moment, is how we can all work together to get those vaccination rates up in Haringey.
Okay, I'm not sure how our two experts are going to deal with this next question. Black MPs of all political persuasions launched a video to encourage Black seniors and Black communities to have the vaccine. If they're not able to persuade Black communities, how are experts going to be able to get that message across as well?
So there's a number of reasons, a number of concerns people have about the vaccine, and that's why you need lots of different approaches. So you're right. So for a lot of people, myself and yourself, Leader, and Dr. Patel may not persuade people, but I think anything we can do to answer and address concerns people have. Then you might have other messengers, like some people like to listen to footballers or music stars. Some people might listen to MPs. And then there's other things that we need to do, like friends and family are really influential as well. So one of the things I'm worried about is younger people in our communities telling their elders, oh no, I'm a bit worried about you having this vaccine, I've heard X and Y. So we really need to reach out to all our communities using all the different messengers that we have. And we're actually doing a lot of that already, that we've spoken to faith leaders, we've spoken to Tottenham Hotspur about doing work. So I think this is all, a role for all of us. We've all got a role to play. And I think as someone who's seen as an expert, I think anything that we can do to give a really balanced response and give honest and transparent answers to people's questions is just part of that wider program of work we need to do.
Okay, I've asked the next question of both of you. If you're having a day off from being an expert and you're just talking over your garden fence to your neighbour, what would you say to your neighbour if they were hesitant about having the vaccine?
So that I'm going to give the example of my family and friends and people at work who we've spoken to. So the advice is to get the vaccine if you're eligible. I mean, my wife works in intensive care, or she was redeployed to the doctor in intensive care. She was seeing young people, particularly from minority ethnic groups, people in their 50s, on ventilators. And that is how serious COVID is. And the vaccine is safe and effective. People are getting maybe, a day of a kind of not feeling 100% off the vaccine, but compared to being on intensive care. But the other thing I would do is just listen to any concerns that they have and just keep that conversation open. Sometimes it's not the first time you speak to them, not the second time you speak to them, it's because your neighbour's neighbour has had the vaccine and they tell them. So it's an ongoing dialogue, but I would definitely say, please go and get the vaccine if you're eligible.
I'd say the same. I think, sort of think about in the past, how many diseases that we have eradicated with vaccines. And just think that we will look back and think, and we will know that this vaccine has eradicated this, helped us come out of this pandemic. I agree with Will. If there's a question, no question is silly. If that question is bothering you from having the vaccination, then you need to ask it. Your GP, even if you come to the clinic and you're thinking of the question at the time, just ask it. Everyone is happy to give. And I suppose the only other thing I could say to somebody is, if I had any qualms about its safety, I wouldn't take it myself. So I'd hope that would help reassure them.
Okay, so effectively, for the people who are closest to you, your nearest and dearests, you are 100% recommending the vaccines. Is that right?
Absolutely. Yeah. Yeah.
Okay. Okay. I think we've got through all of the questions. I know that one of the things that we were going to briefly talk about is almost like the history of vaccines and the fact that there's always been an element of caution, if not hesitancy, about when a new vaccine comes onto the market. But diseases like polio and measles have been adequately controlled in the past. Would we expect the history of this vaccine to to be successful long term?
I hope so. I do hope so. And I think even if it changes slightly, there is good ability to, as Will said, to change it slightly, that we may need a booster. But for now, I think we need to all have the vaccine to try and go forward.
Okay. Can I ask, when we're talking about vaccines and vaccinations, there are people who are in different stages of life and are concerned about how taking a vaccine might impact upon things that are valuable to them, important to them. Is there any evidence that the vaccine impacts upon mothers who are breastfeeding, or on potential mothers who are seeking to become pregnant?
So shall I take that one? So there is good evidence. So I alluded to it in when I spoke earlier, that I mentioned that there was a tiny piece of evidence which was never substantiated later. We've had women who are, so we now offer COVID vaccines to women who are pregnant. However, we only offer it if they have risks, if they are at high risk themselves. So, for example, if they are a diabetic who is at risk of severe disease with COVID, we would highly recommend the vaccine. Why would we not offer it to a woman who is pregnant with no other risk factors? Purely just because in every part of medicine that we do, we balance any risks versus any adverse effects. So far, the evidence is saying that it's absolutely safe. However, we just need to be careful that we give it to women who would benefit from not getting COVID as well because of their other risks. So I know that's a very complicated way of saying it, but what I would recommend highly is that if you are pregnant, I would speak to your doctor. And if you feel that you need to have the vaccine because you are clinically vulnerable in any other way, then I would speak to your doctor, who will be able to discuss it further with someone like myself, or they may well have all the knowledge themselves to discuss it further with you. The other one you mentioned was breastfeeding. So there is no evidence to say that there would be any harm to the baby, but we just don't have enough evidence. As with most medicines, they can't be tested on pregnant women or women who are breastfeeding. So it's, evidence we find that as we go along. So again, if the woman was at risk of COVID, of sort of severe adverse effect of COVID, then we would give her the vaccine as well. So so it is a case by case, but it is safe as well.
Okay, with regards to children, it's going to be a while before the trials are completed. Is there any likelihood of children who are clinically extremely vulnerable being treated with one of the vaccines before the trials are completed?
So it's a very difficult one because it's unlicensed at the moment, and there is something that I have been looking at, and it's something I'm going to discuss with our paediatricians. I can't give that answer at the moment. The trials are not due to finish for a while. We can give those children who are over 16 because we can give them Pfizer vaccines. But younger children at the moment, the evidence isn't there. It may well be okay, but at the moment we can't say that. And it's something I was going to have a conversation with our local paediatricians to get their thoughts on it.
Okay. Urban legends. There's an urban legend that if you hang around outside a vaccination center, you can get the unused vaccines at the end of the day.
Please don't. So I can assure you, not one vaccine goes to waste. So we will just look at, I have great receptionists. So I have to say, right, there's 11 left in that vial. I then get my receptionist to look at the next list, and they will call people at last minute. And people will either say, yes, I can come down and be down there with you in the next 5 minutes, or actually not. I mean, we do it a little bit more than 5 minutes, but not one vaccine is wasted. Please don't come and stand outside unless you are if you are in an at-risk group and you think that you should be on a list. Contact your doctor. They can discuss it with you. They can discuss it with me. We can put you on a list. We can put you in even if we feel that the coding hasn't put you in the right category. But as Will said, every adult will be vaccinated by the end of summer. So people will get their turn. If you take it for, if you have one above somebody else who has a greater need, we've just got to think about it as a whole population, really.
Okay, so just to reiterate, no vaccine goes to waste, and there
No,
is no point people queuing up just to get that last vaccine because it doesn't exist.
no. There is somebody who gets it who is at risk.
Lovely. You see, that's the thing about urban myths and urban legends. We can put them to rest at
Thank you.
moments like this. Okay, look, I think we've rattled through all the questions that we've had and we've got. What I will ask before we go on to closing words, what I would ask is if you, Dr. Sheena and Dr. Will, are prepared and able to come back and do another one of these, it may be 5 to 6 weeks time, if that's okay.
Yeah.
Yep. Okay, could I ask if you've got any closing words for our audience today? Dr. Will.
I just think it's been really good opportunity to answer people's questions, and there's lots more information available in NHS websites, our websites as well. We've got some really good videos of people talking about the vaccination from lots of different groups. And for those people who are eligible for their vaccine, haven't had it yet, I would urge them to make that step and have the vaccination. And it's been great being part of this event. Thank you.
Thank you very much, Dr. Will. Dr. Sheena.
I agree fully with everything Will just said, and thank you for inviting me. And if there are any questions, you can always send them through to your GP, who can then filter them. You can send them through to our federation or myself. I mean, we're happy to answer any of these questions, and but please come and have your vaccine.
Okay. Can I thank Dr. Sheena Patel and Dr. Wilma Maris for being our experts here answering questions of the Haringey residents. Can I thank everybody who's taken the time to join us today? Really appreciate your time. It'd be good, as I've said, if you can just pass on the message to others, or when we have another event like this, if you can encourage people who still have questions and concerns to come and to join us. So thank you everybody for being here this evening. Hope you have a safe evening, and when the opportunity comes to get your vaccine, please take it. Thank you very much. Good night, everyone.